we're all in it to get people well. So you don't have to just take a pill and feel better, but what you have to do is you have to start working on what is the underlying cause. That's what the integrated model does. We take an approach where we look at the three aspects of health: the mental component, or some people call it the spiritual component, the physical component, and that is like the muscles and the tendons and the ligaments and the bones and the nerves, and then there's also the chemical component, and that is the biochemistry of the body. Not a lack of drugs, but the proper chemistry of the body. When you look at that, you have to start paying attention to things like, in an integrated model, you can approach all of these things from an integrated point of view. But what we do is we try to work on what caused the malfunction in the body. It's basically creating a toolbox of function-based outcomes as opposed to covering up symptoms with drugs and surgery to just relieve pain. If we do less invasion and more of the function-based approach and create an environment where people feel safe to get it, going to a medical provider who says, yes, you need to get chiropractic care, it's an important part of this program, well, then those patients are very much more likely to get that chiropractic care. And now we're starting to tap into that 90% of the population who don't know what to do because they feel jaded against chiropractic. You can get them to realize chiropractic is not what they thought it was. It helps them to get better, it improves their body functionally, and now they're not taking drugs or getting surgeries, and you can break that cycle. The earlier we get these people, the better it is. So this model, the reason I love it is because it helps so many people, because what is the number one complaint that people have? Well, number one complaint is pain. It's an $800 billion a year market. And if you look at how much of that is just for spinal pain, well, the Institute of Health Metrics and Evaluation of the University of Washington Medical School says 60% of that, or $480 billion a year, is spent on pain medication to relieve spinal pain. We could do a lot better job. By taking a functional approach, we would probably be prescribing tremendously less drugs, which would be a good thing if you're the patient. It might not be so good if you're selling the drugs, but I'm sure they'll understand we're all in it to get people well. That's why we like the integrated model. It does help people get better because it addresses their functional malfunction, which causes a symptom, instead of just addressing the symptom and let's get rid of the symptom. If we get rid of the malfunction, then the symptom goes away and stays away. So if you'd like to learn more about our functional approach to healthcare in an integrated model, go ahead and subscribe and drop a comment.